the original Project START is a risk reduction program focused around HIV, STI, hepatitis risk reduction for individuals coming out of correctional settings into the community. And that one of the main things that makes Project START a bit different than maybe some other risk reduction programs is one, that it was developed, researched, packaged from day one specifically for folks in correctional settings returning to the community. So it was not a more general program that has been adapted for correctional settings. So from the ground up, it's really been designed specifically to work both in the correctional systems and some of the challenges we talked about there, as well as for folks involved in the criminal justice system. And another big part of Project START that I think is extremely valuable is that it does indeed have a core around HIV, STI, hepatitis risk reduction, but it is packaged within the larger transitional life needs that an individual may be facing as they're coming out of criminal justice system. So it is indeed about HIV, STI, hepatitis risk reduction, but it's also about helping individuals get support for housing and jobs and other life needs, in the sense that, when an individual is getting released from prison or jail, they don't categorize their needs or silo their needs. They really are one individual facing many different issues. So this is a program that really helps the individual address their life needs comprehensively based on what's going on with them. And then the only other piece I would add there is that Project START has done a lot of adaptation recently towards working with people who are living with HIV. So we have a new model called Project START Plus that is a lot of the old model around kind of standard risk reduction and the transitional life needs, but incorporates some of the more specific issues that somebody living with HIV may want to address as they're leaving corrections, most specifically continuing to link somebody into medical care upon release. Because, as I'm sure you've heard from others, we know that a lot of folks will get linked into medical care, substance use, mental health care while they're on the inside, but that treatment or support doesn't always continue when somebody is out. So Project START Plus will indeed do that with an additional focus on linkage into care, medication adherence, disclosure, all that kind of thing. So, just a good packaged evidence-based intervention that hopefully meets many of the life needs of an individual coming out of prison or jail. The biggest successes is that we're able to really disseminate a lot of the practices that we're aware of, and or we've done a lot of work in, and not only the effective interventions that we were involved in directly, but myself and my business partner Barry and our small group of consultants have worked widely across the U.S. as well as in some international instances, and along the way have really learned quite a bit of effective practices and interventions and policies and procedures. So we do a lot of disseminating of effective practices. Again, quite a bit with a public health perspective around kind of screening and testing for various diseases and treatment, along with reentry and linkage to care programs. So I think that's one of our biggest successes, that we're really able to disseminate all the great practices that are out there. I think another big success we have, because our group are all folks who come from direct work in correctional settings. Before we got into more kind of third-party evaluation research, is that we really bring, I think, a more hands-on, concrete understanding of what works and what doesn't, what we know and what we don't know. So we bring to our evaluation and our research work and our training work some true real-life filters. And so it doesn't mean that we necessarily have all the answers or know everything, but I think we know the right questions to ask to really help people better understand what it takes to do this work, whether it's to build effective collaborations between community providers and correctional facilities, between health departments and correctional health providers, whether it's looking at taking a program model that may work in one facility in one department of corrections and looking at how to make it work in the facility or department that an individual is working in. Again, it's not that you can just plunk things down, but we can, I think, have very good, honest, and deep dialogue that's based on our understanding working in the systems about how to figure out how to make it work or if it will work. So I definitely think I would see that as two of our largest successes is just dissemination and coming from that kind of direct real world experience. I think there's tons of stereotypes that are, and I think they're reinforced by media outlets and kind of our sensationalized fascination by folks who are involved in our criminal justice systems. And, at the end of the day, I think people would be surprised that folks who are involved in the criminal justice system, first of all, get involved for so many different reasons, and that the vast majority of people involved in the criminal justice system are truly folks who are trying to make a better lives for themselves and others and really, really want to make some changes and different choices. So I've just continually, both in my direct service and then in kind of more my consulting work, I'm just continually inspired by individuals who by all means probably have as many odds against them as we have in our societies, but are really there and dedicated to making some changes in the right direction for themselves and for others. And I've truly seen people turn their lives around, and it's very impressive. And having to go up against barriers that most people in mainstream society wouldn't even, have a second glance at, that to really be responsible for where you are at all times, for any changes in residence, for changes in employment, for, some of the barriers around housing or what have you. I mean, there's so many other obstacles in their path, and just to see folks truly navigate that in a successful way is pretty impressive. And I think sometimes goes up and beyond what those who are not involved in criminal justice have had to face and may even not necessarily have the skills to handle. So